This conference will now be recorded.
अद्य शनिवासरः अथवा मंगळवासरः श्रावण शुद्ध त्रयोदशी दिनांक 1 ऑगस्ट 2020 लोकमान्य टिळक पुण्यतिथि सहस्रयोगम भृंगामलकादि तैल शंखं चक्रं जलौकान् दधतमृतघटं चारुदौर्भिश्चतुर्भिः सूक्ष्मस्वच्छातिरुद्यां शुकपरिविलसन् मौलिनं भोजनेत्रं कालाम्भोजोज्ज्वलाङ्गं कटितटविलसच्चारुपीताम्बराढ्यं वन्दे धन्वन्तरिं तं निखिलगदवनप्रौढदावाग्निलीलम् प्रौढदावाग्निलीलम् ब्रह्मणो हि समारब्धा मात्रेयाद्येषु पूजिताम् अस्मदाचार्यपर्यन्तां वन्दे गुरुपरम्पराम् आयुर्वेदरतं वन्दे माधवाख्यं महागुरुम् आयुर्वेदामृतं सर्वं शिष्येभ्यो यः प्रदत्तवान् द्रष्टाज्ञानी दृष्टकर्मा कृतकर्मा तथैव च अध्यापको विश्वश्रेष्ठो महान् संशोधकस्तथा गुणैरेतैः समुदितैः यत्कार्यं प्रतनोति सः समृद्ध्यर्थं हि कार्यस्य वयं नु प्रयतामहे सरस्वत्यै नमो यस्याः प्रसादात् पुण्यकर्मभिः बुद्धिदर्पणसङ्क्रान्तं जगदध्यक्षं क्षते आत्रेयं प्रथमं वन्दे आयुर्वेदजगद्गुरुम् आयुर्वेदामृतं सर्वं गृहीत्वा हि सुरेश्वरात् अग्निवेशादिकेभ्यो यत् प्रयच्छत् मुनिसत्तमः प्रथमं तन्त्रकर्तारम् अग्निवेशं नमामि। भृङ्गामलकादि तैल मृगा भृङ्गामलक रसप्रस्थे तैलप्रस्थं फलं च मधुकस्य क्षीराढके विपक्वं बलाकामपि कोकिलं कुरुते अन्धमनन्धं कुरुते बधिरम् अबधिरं तथा च चलदन्तं वृद्धोऽप्युपचितपीनरसो भवति मानरो मासमात्रेण तर्हि इदं साधु दृश्यते सरलः पाठः एवञ्च बलाकामपि कोकिलं कुरुते तर्हि स्वर्यम् अन्धमनन्दं कुरुते चक्षुष्यं श्रावणं चलदन्तं वृद्धोऽपि उपचितः पीनरसो भवति नरो मासमात्रेण तर्हि वृद्धोऽपि नरः मासमात्रेण अमलकस्वरस्य क्षीर पालित्यहर this is new Swarya Chakshusya Badhivyahara and Chaladanta. So what I feel is whether this is available in the market or not, Brunga Malakadi. If it is available, then that is fine. Else we may try to prepare this and may use particularly for Nasya. So and even for Abhyanga in old people as such. So does anybody know that whether this is available in the market or not? एकधात्रो बलाधात्र्योः गुरुश्चास्तु तदर्थकम् उशिरस्य तदर्थकं स्यात् तदर्थं बिभेरकम् तदर्थं चन्दनं यष्टि प्रसूनं बकुलस्य च द्रोणेषां साधयेत् सम्यक् चतुर्भागावशेषिते अत्र कल्कं प्रदातव्यं बधुकं चन्दनद्वयम् कुष्ठमुत्पल अब्दं च शारिवाच त्रिजातके जातिफलं च तत्फलं कर्पूरं च शतावरी जीवकर्षभतो मेधां मृद्विका कुङ्कुमं तथा लामञ्चकं च शालूकं चोरकद्वयपुष्करम् नागपुष्पं नखं स्फुट्टा मञ्जिष्ठा कटरोहिणी अञ्जनं सरलदारु चम्पकं मृगनाभिकं मधुकपुष्पं शोणाकं त्रिफलाफलिनी विशिः मुस्तागुरु तथा मांसी तगरं पद्मकेशरं कषायस्य समं क्षीरं रसम् आमलकं तथा दत्वा तत् शतावर्याः तैल प्रस्थं विपाचये तद्वत् शतावर्याः तैल प्रस्थं विपाचये. This is quite big part. Just are available. So what they have to say about aged persons would be nourished within 1 month. Can't say with what way it is to be used, whether it is used for abhyanta, whether it is used for abhyantara pana or pasti. But generally diminished agni, diminished bala, and diminished ahara. So prusha, this prushatva is very common, and that might be helpful maybe internally. But why Taila? Again, this is again important aspect. So Brunga and Amalaka both are Rasayana and Yashtimadu and Kshira. These are only ingredients, so to say. So maybe we have to think about this, whether we can do some other kalpana from this and use it in that particular way. एतत्तैलं निहन्त्याशु पानाभ्यञ्जननावनैः शिरोनेत्रगतान् रोगान् अन्यान् पित्तान् नीलोद्भवान् अङ्गदाहे शिरोदाहे नेत्रदाहे शिशस्यते शतक्षयहरं वृष्यं रक्तमांसबलप्रदम् ऊर्ध्वजत्रुगतान् रोगान् विशेषेण विनाशे. So Baladatriyadi is available. Brungamalaki Taila, ABS. Valia. Valia Brungamalakadi Taila, ABS. Okay. And Baladatriyadi is also available. The Falashruti is quite wide. And secondly, Pittanila Roga, this is again something very specific. Shironetra Rog, Angadaha, Shirodaha, Netradaha, Shatakshayahara, Vrushya, Rakta Mausa Balaprada. So this is very typical, Rakta Mausa Balaprada. This is very typical. So I think I'm gonna find. If you prepare Gruta from this instead of Taila, that will be better. I don't know whether there is similar part for Gruta from this. Instead of going for Gruta may be used internally, and this may be used externally, Pana, Benjan, and Navan. When it is given for Pana, but for Benjan and Navana we can definitely do. And particularly this would be useful in cancer patients. Again, I'm looking for medicine most often for cancer patients, and those who are on chemo and radiation. This is a better choice. And it is Vrushya Rakta Mausa Bala Prada. So this is again very important. Or at least we may go for Yamaka Sneha, and that should be fine. Whether there is Kshira in this. Madhuka Chandana Dvaya, Shweta and Rakta Chandana, Pushta Utpala Abda Musta Sariva Trija Taka Jati Phala Takkola Karpura Shatavari Jivaka. What is Takkola is still not understood. Rushavaka Meda Mridvika कुंकुम, लामज्जक, उशिरभेद, शालूक, कमलकंद, चोरक, द्वय, पुष्कर, नागपुष्पा, नख, स्पृक्का, मंजिष्ठा, कटरोहिणी, अंजन, सरल, दारू, चंपक, मृगनाभी, मधुक पुष्प, शोनाक, त्रिफला, फलिनी, मिसी, मुस्त, अगरू, मांसी, तगर, पद्मकेशर, तैल, बलाधात्री, आमलकी, गुडुची, उशीर, रिबेर, चंदन, यष्टी, बकुल पुष्प, जलवंद्र. प्रिपेयर चतुर्थावशिष्ट कषाय क्षीर इक्वल टू क्वाथ, आमलकी स्वरस, शतावरी स्वरस इक्वल टू क्वाथ. So if it is going to be used for pittavata, then कर्णफूल मसाल्यामध्ये वापरतात. कर्णफूल. I have heard दगडफूल, not कर्णफूल in masala. Okay. Stana, Abhyanga, and Navana. So शिरोरोग, नेत्ररोग, पित्तवात रोग, अंगदाह, शिरोदाह, नेत्रदाह, शतक्षय, भृश्य, रक्तमांस बलप्रद, ऊर्ध्वजत्रुगत रोग. So रक्तमांस बलप्रद, this is also typical in this. And ऊर्ध्वजत्रुगत रोग and Vrushya as well. So anyway, we can start using this particularly for Abhyanga and Nasya. That is one thing. And if we prepare Vrita from this instead of Taila, that may go for Abhyantara Snehapana, particularly in cancer patients and who are on chemotherapy and radiation. This should be very good for that. And Shiroga, Netraroga. We may have to inquire about this. Secondly, Vaibhavani has found out that this Gavyamruta, Patmeda, they have their own ghrutas, medicinal ghrutas in Desi cow ghee. Those are available with their website, directly sale from that. You can order through Amazon as well, but you can directly order with them. So I have confirmed that they are in Desi cow ghee only. And Kalyanaka Ghrita, Mahatiktaka Ghrita, Phalaghrita, these are available directly in Desi cow Ghrita only. So I'm going to order a few one and going to use them, and then that will be fine. So anyway, we were looking for preparation of medicated ghee in this, and on with Desi cow ghee. So if this is available, readily available option, that we may try to explore. This part is quite big, and if Balada Tradi is available, we can ask one company if they can prepare this with Desi Gogruta. That will be. Can we get details like contact number on our website? Youth search Gavyamrita in net, and you will find their website. So Gavyamrita is the word. So anyway, I will try to order this Balata Triyadi, and even this Brungamalakadi is also good. This is not in my practice as such. तुङ्गद्रुमादि तैल तुङ्गद्रुमस्य तरुणस्य रसे सुगन्धा लामज्जयष्टि मधुकोत्पलचन्दनानां कल्केन दुग्धसहितेन विकल्पमेतत् तैलं शिरोनयनतर्पणम् अर्पणेन तुङ्गद्रुमस्य तुङ्गद्रुम तरुणरस टेंडर कोकोनट वाटर सुगंधा कचोरा लामज्जक उशीरभेद यष्टि मधुक उत्पल चंदन कल्पेन दुग्धसहितेन विपक्वमेतत् तैलम्. So Taila here might be Kera or Nalikere. Coconut oil will be better over here. Anyway, they are using coconut water. Tailam Shironayana Tarpanam Arpanen. Shironayana Tarpanam. So this is also not very difficult to prepare. Tender coconut one can get easily. Is this available? Tungadrumadi? Tungadrumadi Taila? Does anybody know? So let us see. Chandanam Madhukam Kushtam Ashwagandham Suradram. Chandanadi, this is available. Tushiram Utpalam Mausi Patragur Nishabala. Riveran Nagakuswam Spukko Manshta Sarivaha. Tagaram. Mruganabhishcha. Vaidyaratnam available. Okay. Yes, sir, available. AVS also. So Tungadrumadi, whether it is til oil based or coconut oil based. Keratil or Tagaram Murganapisha Shatapushpa Harenukam Sukshmailabdam Vacha Chora Barbar This Sukal Kitaihi Ketaki Mudujak Wate Sakshire Tilam Pache. Here it is specifically Tilaga. Tadabangad is Tailam Vata Shonita Nashanam Angadahe Shirodahe Netradahe Chashyate Dvarancha Vishmam Shite Purashvityam Vinirvitam. Okay. So Abhyangadi bhi ABS Tila Taila. Okay. Jwarancha Vishmam Shite Purashvityam Vinirvitam. This is also a good part. Chandana Madhuka Kushta Ashwagandha Suradruma ऋषिर उत्तल मांसी पत्र अगरु निशा हरिद्रा बलारी बेर नागकुसुम स्प्रिका मंजिष्ठा सारिवा तगर मृगनाथी शतपुष्पा हरेणुका सूक्ष्म एला अब्दमुस्ताद कचोर चोरक बर्बर भारंगी तैल वनप्रस्थ केतकी मूलक्वाथ क्षीर वातरक्त अंगदाह शिरोदाह नेत्रदाह विषमज्वर Abhyanga so with Abhyanga it is to be used. So maybe try to use this in Vatarakta as well. In Daha it's more. And maybe in neuritis kind of things. So anyway. Amrutakvata samsiddham tailam chandana purvakaha सारिवो शीर कृष्णाब्द धात्री सोत्पल तस्करैः कल्कीकृतैर्निहन्त्याशु वातरक्तं शिरोगदं रक्तपित्तकृतान् रोगान् आशु हन्यात् सुपूजितम् चन्दनपूर्वकैः स्यात् इति मन्ये सो चन्दन सारिवा उशीर कुष्ठ अब्दधात्री उत्पल तस्कर कचोरा. So these are the kalka and amrutakvata. There is no milk in this. So I think this should also be available. Vataraktam shirogadam. रक्तपित्तकृतान् रोगान् आशु हन्यात् स्फूजितम्. This also seems good. Is this available? Mrutadite. Dhurdhuradite. धूर्धुरपत्र स्वरसे तद्बीजैः श्लक्ष्णक्षुणितैः पक्वं तैलं निहन्ताशु कण्डूकेषु च्युतिनृणाम्. So this is just Dhurdhura, Datura. बहुतेक तैल सिद्धिमध्ये दुग्ध वापरते आहे. Yeah, that is true. But in this particular tail, it was not there. So where it is not present, Amrutadikari, why it is not, that we may have to think about. So Shlakshna Churna of Datura Bija and Datura Patra Swarasa Kandukesha Chutin Runam. I use this particularly for dandruff. And it works. But I have used Durdhura Patradi, not Durdhuradi. Is there any difference in Durdhuradi and Durdhura Patradi? Kandu Koshachuti, Keshachuti, hair forming. So this is single. Jimutadi. Jimuta Brunga Karavira Nisharka Nilya, Tesham Rase Tilajameka Rasena Tilyam. Karpas Mula Saitan Ruduman Nipatwam, Tailam Sukesh Patanam, Vinihanti Kandum. Jimuta. I'm not remembering what is Jimuta. Brunga Karavira Nisha Arka Nili. Tilajameka Rasena. जीवूत भृंगराज करवीर निशा अर्क नीली स्वरस तिलजम एक रसेन तुल्यम. Hmm. Hmm. So Taila is one part and Jimuta Brunga Karavira Nisha Arka Nili Rasa one part each. Najam ras Eka Rasena Tulyam Karpasa Mula Sahitam Budvandi Pakvam Tailam Sakesha Vatanam Vinihamti Kandu. So Kandu and these things. Whether this can be used for Livka and Liksha, these are the previous one that may be thought. Nili Brungadidel. Now this is very famous, commonly used. Nili Brunga Rajash Shatak Kratu Lata Dhatri Phalanam Rase Shirei Ajanaka Ajaka Nalikeer Mahishi Dhenu Dhoi Sadhitam. Tailam Paya Tat Payasai Vupishta Lulitai Yashtavya Gunjanjanaihi Keshan Sanjanayet Tale Pikarayor Astam Akesham Shirah. So this is Petradurdur Patra, the different part. So Sanjanayet Talepi Keshan Janayet. So it can create Kesha even on Hastatala. Astam Akesham Shiraha. So what to say about Akesha Shira? So there also it definitely helps in getting hair. So bald people, this may be Yashtyamha Gunja Anjana Taila Nili Brungaraja Shatakratu Data Indravaruni Dhatri Ajakshira Nalikera Mahishakshira Bhenu Bhava Gopshira. This is very typical alopecia. Yes, definitely we can give alopecia. Kalka Sneha Dravya and Drava Dravya is taken. Kesh. He doesn't say anything about Hastatala Sveda, etc. Hastatala Kesha. So this is very typical. Hastadanta Mashi is also having this characteristic. So if we get an access to Hastidanta, then this should be fine. Now ornaments of this are available in museums or some these shops, gift shops. But these are very costly because they add the cost of preparing it. But otherwise, if we get Hastidanta, then that would be fine. But anyway, Nili Brungadi is easily available, and I have used it in many cases, so that is fine. Ankola बीज मरीच पुष्टैः कल्कीकृतैर्विषक् तच्चेत् बकुलपत्रस्य गम्भीरस्य रसाळ तैलप्रस्थं शिरोभ्यङ्गात् चिरः कुष्ठविनाशम्. Ankola बीज. What is Ankola? I don't remember. Maricha, Kushtha, Taila, Bakula Patrasvarasa. It was Bakula Pushpa before. Now this is Bakula Patra. Jambirasya Rasadake and even Jambira Patra Palasvarasa. Tailaprastham Shirobbenga Chiraf Kushta Vinashana. This is particularly for Shira Kushta. Now in psoriasis, there is a patch in Shira. Generally, psoriasis is found on hands, leg, abdomen, and back. And in many cases, there is patch in the head region as well. So maybe think about this, particularly for Shira Kushta, and maybe applied over psoriasis as well elsewhere. Ankole is Alangvijayam Lamarki family, Alangiaceae. Okay, that is the local name, so to say. So, Shirakushta scalp skin infection. नीली निर्गुंड्यादि नीलिर्निर्गुण्डिका भृङ्ग धूर रजनीस्तथा कोशातके च चिञ्चातौ तेषां सारे चतुर्गुण त्रिजात बाकुची कुष्ठैः तैलं सम्यक् विपाचितं सत्करात्र प्रयोगेण कपालार्शौ विनाशनम् कपालार्श त्रिजात बाकुची कुष्ठ तैल नीली निर्गुण्डी भृङ्ग धुर्धुर रजनी कोशातकी चिंचा कपाल अर्शस कपाल अर्शस where is kapal arsha in kapal nasarsha karnarsha these are C. So generally I tend to use arsha chikitsa along with some nasya in nasarsha say tapyadi loha suran vatak etc. internally and also instill some oil in the nostril. If it is too big, then we may go for Kshara Taila. Otherwise, you can go for Anu Taila or Shadbindu Taila, etc. This Kapala Arsha, I don't know, Nili Nirgundyadi is available in the market. And Arsha Kapala, this is Kapala Kushtha. That might be Kapala Arsho Vinashanam, that might be Kapala Kushtha. And Arsha. Kapala Roga, Shiro, Arsha Roga, Asasilta. That might be the thing. Or that might be Kapala Kushtha as well. Is this available? Nili Nirgundyadi? So you say that available. Yes. Okay. Kapala Roga, Shiro Roga. That might be a thing. Scalp warts. Maybe we may think about this. There are people seen with scalp warts, etc. And might be this is useful for that. Nili Nishadi Taila. Nili Nishengudi Kshira Valka Vaikunthaje Rase. Tailam Sarjambira Rase Kapalam Vyadhin Shrutam. So Nili Nisha Ingudi Kshira Shiri Valka Vaikunthaja Rasa Tulsi. Nili Nishadi. Nili is need. It's called as Nili only. In Marathi, I don't know what is available by the word Nili. CNS. Okay. So Nili Nishadi is also available on CNS. Maybe download the apps from varieties of companies and try to search what is available. Now we have read this, so we keep this in mind and start using more oil specifically, something like that. Kapala Vyadhi. So again, what is meant by Kapala as such? Whether it is only forehead or external part or internal, Shiroroga as what we may try to see. So whether this can be used in brain tumors, that's another important aspect. Vachalashunadi Taila. Vachanashulashuna dosha dhir. बिल्वपत्र रसे श्रुतं तैलं श्रवणदोषगुणं विशेषात् पूयनाशं दोष दोषभी दोषभी is Haridra and with बिल्वपत्र रस तैलं श्रवणदोषगुणं विशेषात् पूयनाशनं. So there is a custom of putting Lashuna Siddha Taila in ear or egg. So Vataja Karanashula. Neeli is Indigofera tinctoria family, Fabaceae. Marathi is known as Buli. This is available ABS. Vachalashuna Taila. And particularly for Puyanashana. For Puyanashana, initially we may go for Dhupana, Karna Dhupana, and then when it is clear, then apply this oil. This might be good. And Potoria, and if it is infected and Puya is there, then this is good. There is a strange case by Kolhatkar sir. There was a patient like this, oozing and from the ear. And when he examined the abdomen, Purana ear infection. Okay. निळी किंवा इंडिगो नावाने मिळतात. Okay. And Kodakar sir found this that this is due to this goer measles. So the only medicine that he gave was Rajaniyog and Paripadhatikana. And didn't give anything locally. Within 4 days, the patient was all right, no oozing from the ear, hearing proper, and no pain. Without any treatment in the ear. So this emphasizes what Datar Guruji is emphasizing on Ushnata, that is the heat that has been generated and stored in the body, particularly after measles. And now with this vaccination, either there are no measles or it is of not that severity. But then would there is heat felt, particularly in Yakutlia region, in patients. And in that case, even though there is no history of this romantica or gover, one may go for Rajaniyog and Pariparantikana in these conditions. So Vachalashonati, this is available, and this might be used in Karna Shula. If it is Vataja, then this helps, there is no doubt. Nirgundi Rajani Bilvas Nuyhadarka Rase Shrutam, Rasona Daru Bilvabhyam Vishwa Bheshara Kartitam, Tailam Shravana Doshakma, Visheshat Puyanashana, Nirgundi Rajanyadi Taila. Is this available? Nirgundi Rajani Bilvas Nuhi Alarka Rase Shrutam, Rasona Daru Bilvabhyam Vishwa Bheshara Kartitam. Quite Ushna. Bilva Snuhi Alarka Swarasa. So Snuhi and Alarka, these are quite Ushna Tikshna. Karna Rogya Puya Nasa. Visheshat Puya Nashanam, so it is nothing like Nasa. So I'm not sure. I had seen only one case in Tarakan hospital when it was infected and there were Karna and there were maggots. And for the first time I saw removing maggots from this Karnasrava, and of course they were using allopathy, but this is also rare to see maggots getting generated in Karna or Nasa, and we have Surasadigana etc. for that. Arimeda Tvagadi Taila. Arimeda Tvacho Grahyam Navam Palashatam Bhave Negrodho Dumbarashvatha Lakshavalkat Shatam Tatha. चतुर्द्रोणे जले पक्वा चतुर्भागावशेषिते तैलाढकं पच्यत् तत्र कार्षिकैः कल्पितैरिमैः यष्टि त्रिजातमञ्जिष्ठा गायत्री लोधकट्टलैः क्षीरिवृक्षारिमेदत्वक् मुस्तागुरुहिमद्वयैः कर्पूरजाति तक्कोली मांसी धातकी गैरिकैः मृणालमिषिवैदैः पद्मकेशरकुङ्कुमैः लाक्षासमङ्गा भवति बिल्वपत्रसुरद्रुमैः शैलेय सरलस्फुक्ता पलाशरग्निद्वयैः प्रियङ्गुतेजनी पार्थ शरपुङ्खफलत्रयैः कालय पुष्करजटा व्याघ्री मदनसंयुतैः जाते चिक्कणपाकेतु परिस्राव्य निधापयत् तन्नस्य पानगण्डूषवस्तभ्यङ्गेषु योजितम् मुखजानामयान् हन्ति विशेषादन्तरोगज. In the infection, you mentioned that was given along with Rajanyadi Yoga. Rajani Yoga, not Rajanyadi Yoga. And Paripadatikada. There was nothing given in for this year as such. In anything not given in the year. So no local treatment, only internal treatment. So no, this is quite big part, and so many Kartadravyas. So why when so many drugs are combined? This is again important. मुखजान आमयान हंति विशेषात दंतरोग, particularly दंतरोग. Now dentist is a totally mechanical science now, and there is nothing much preservation as such. So there is a vast scope for us to work in Dantaroga. Generally, the pain is very, very much intense and not bearable. So people have to rush to dentist, and there are very few people practicing dentistry in true sense in Ayurveda. Now there are many Netrarog Tatyas who are trying to use Ayurveda in Netraroga, but this is still not done in Dantaroga as such. यष्टि त्रिजात मंजिष्ठा गायत्री खदिर लोधर कट्फल क्षीरिवृक्षत्वक अरिमेदात्वक मुस्त अगरु हिम द्वय श्वेतन रक्तचंदन कर्पूर जाति तक्कोल मांसी धातकी गैरिक मृणाल मिश्री शताभा वैदेही पिप्पली पद्म केशर कुंकुम लाक्षा समंगा बृहति बिल्वपत्र सुरद्रुम शैलेय सरल स्लिक्का पलाश रजनीद्वय प्रियंगु तेजनी वर्धा पार्थ अर्जुन शरपुंखा फलत्रय कालेय पीतचंदन पुष्कर जया मंडन मदन सॉरी अरिमेदत्व 100 फल न्यग्रोध उंदरुंबर अश्वत्थ लक्ष वल्क 100 फल जल प्रिपेयर चतुर्थावशिष्ट क्वाथ कषाय. So prepare Taila with the above, etc. Nasya Pana Gandusha Basti also for Abhyanga. Mukharoga, especially Dantaroga. Is this part available? I wonder whether pharma company prepares this oil by adding all ingredients. This is Arimedadi only. Arimedadi is available and I have used many cases for Dantaroga particularly. It is difficult to say, but either Vaidaratnam, yes sir. Okay. We have to believe in them either or we have to prepare by ourselves. That is the only thing. But since these oils are in the market for many years, Arimedadi is or Irimedadi is available and I am using it last 30-40 years. So and it is unless and until it is useful or it is beneficial, it won't remain in practice like that. So we may have to think about this. Now I feel there are many yogas for oral cancer as such in all this. Sometimes I am putting Arimedadi in decoction for Gandush or Kavala. Punkakvathe bhaya kalka siddhantai dvijartinut. Okay. So this is very simple. So pain in teeth. So Sharapunka Kwat Abhaya is the VS has 2 Tailas. Arimedadi. From Sahasrayogam, Valiya Arimedas Tailam from Vagbhat. It is Valiya. Okay. I have been prescribing Irimedadi and not Arimedadi. It is available by Irimedadi Tel, Basti also. Yeah, there is a strange story of Vaidya Madhav Shinde about this. So there was severe pain in the teeth, and there was nothing noticeable in the teeth. Still, the pain was there. It is the same. Okay. And he had been to other dentists. They had given analgesic. It was having a temporary relief, and nothing was found. Schindler said that I very costly Russian injection, and but that is not given intramuscular. It is to be given in anus. So if you are ready, then I will use it. The patient said okay, and then he gave on matra basti of pain, and that relieved the pain. But Shende sir said if I would have said that this is just oil enema that I'm going to give, the patient would not have opted for that. When I said a Russian injection, then he admitted it, and that relieved his pain. Ultimately, it is associated with the Vata dosha. What will be option for root canal treatment of teeth? I can't say. So basically, generally the tooth decay starts within two teeth, and that is due to lodged food into that. And proper brushing is required. And with whatever ways we do, it is not sufficient. And then the decay starts, and then this pain and other things, etc. etc. So this is root canal is of course a mechanical treatment. So you make it without any sensation, and that is why there is no pain. But truly speaking, what to do, how to deal with this tooth decay, which starts in between two teeth. So ordinary brush and other things, they are not that much useful to clean. And this foaming action, that's what they say about toothpaste as such, is also not sufficient. That is the thing. There is one interdental toothbrush, what is called as proxy or something like that, proxa, and that is to be used after brushing, and then nothing remains in that. But still, there can be possibility. And pratar bhuktva, what is more important, we do it night definitely as per conventional system. We do it in the morning, but we don't do it after food. So we should be doing it after eating anything. Ideally, we should be eating only twice a day. And then once in the morning and after food, that should be sufficient if you are not having a munching habit or something like that. And then this becomes troublesome if that food gets lodged, and ultimately we have to go to doctor, dentist for pain, and then whatever he suggests that we have to follow or something. So this is again important aspect. I have heard that Mangal Buddha Yuti in Patrika is responsible for extraction of tooth. So you may check that if there is Mangal Buddha Yuti in your Patrika, then that leads to tooth extraction. You are forced to go for that. So this we may have to think separately. There are Vaidyas who are married to these dentists as such. Shraddha Shalgar is one of them. Rakesh Shalgar is a known dentist for this. and that way is open. The only thing is what exactly to be used, that we have to decide about that. And what I feel like in Netraroga, if we have full history of the patient, like what we do for other patients, like I chikitsa patient, then we may understand it better. In Netraroga, it is very essential, but that also may be the practice for any roga, Mukharoga, Dantaroga, whatever. Raktamausapaachak, Triphala, Google, etc., and then locally Gandusha, etc., can avoid RC in some patients. Okay. So this also Punkhadi Taila might be useful, but we have to keep the teeth clean. Another big important aspect over here is the recession of gums, formation of tartar. That is another important aspect. And Shende was of opinion that he was using Guruchi Churna, which was very fine, Lakshma Churna, for Danta Dhavana, particularly for tartar. He said it is this stanatma of the kapha that leads to tartar. And in order to avoid it, once it is formed, then it has to be mechanically removed. But along with that, some tissue is also gone. And so there may be dantaharsha, etc., etc. So as far as possible, if we go for cleaning of teeth on a regular basis, every 6 months or something like that, and see whether there is any deposition of tartar and remove it. Rakesh Algar is of opinion that laser treatment is useful in this, and if you do it once in 6 months, that avoids this accumulation of tartar, and cleaning is better in that situation. Of course, these are all mechanical ways, but the whole dentistry is based on mechanics now. So, like these, we may try to consider this. Only thing is, when there is a severe ache in the teeth, there is one verse, there can be no philosopher with an aching teeth in his mouth. So you can't think anything, you can't bear that pain, that is very severe pain. And then you surrender yourself to analgesics or something like that. So this has to be avoided. And
ठीक है दूध आंदोलन शुरू है यहाँ पे दूध मिनट नहीं
so this has to be avoided as such. And as such, we are not looking for swasthya of our netra, karna, danta, mukha, etc. as a vaidya. Truly speaking, it is our responsibility to look into these as such and try to keep us healthy on this front as well. But unfortunately, no care is being taken for Indriya. Maybe we have to do regular Nasya, Abhyanga, Karnapurna, etc., or Anjana, etc. सध्या पाण्याची सूक्ष्म पण वेगवान धार दातावर पकडून टार्टर सहजतेने काढले जाते. साध्या पाण्याची. If it is in the initial stage, then only this may be removed. When it becomes fixed, then it is very difficult because they have to work hard with that broker kind of thing. And this may be initially, this might be useful. I have tried to use injection syringe for removing whatever water jet they say. Yeah, but water jet, there is one equipment available for water jet, and bare minimum cost is 3,500. There are more sophisticated in this as well. But I have used water jet, and I didn't find it much effective as such. But maybe one can use, if you do it regularly on the regular basis, then there will not be accumulation. Once there is accumulation and that has become firm, then it is very difficult. So we should be taking care of our teeth on regular basis, and then maybe can use spray bottles, but that's not very forceful. In water jet, the machine that is available, it's a pump, and it goes with a force. So at least whatever has been lodged in between two teeth is taken out. So I'm not sure whether spray bottles will be of that help or not. Maybe we try, but we may try to give attention, more attention to these. And maybe I would ask Rakesh or anybody else who can deliver a lecture on what are the common problems that are seen in dentistry, or what people come to them, and what can be easiest ways to deal with them for prohibition of diseases or preventing the diseases. So we may have this kind of thing. Anyway, we conclude here and continue tomorrow. We use Pathyadi Shadanga Ghana in toothache. Excellent results in diabetic patient also for toothache. Pathyadi Shadanga Ghana. Okay. This is from Chaitanya Pharma or which pharma? आयुर्वेद प्रकाण्डो निगदित इह हि शल्यतन्त्र प्रधानः शिष्येभ्यः शाश्वतोऽयं निखिलजनकृपा व्याप्तचित्तेन येन आयुर्वेदस्य वाञ्छन् पुनरपि भुवने तां च सुष्ठुः प्रतिष्ठां श्रेष्ठं धन्वन्तरिं तं प्रणमति च सदा वैद्यवर्गो हि नूनम् वैद्यवर्गो हि नूनम् विरम्यते व्याख्यानव्यापारात् सोमवासरे पुनरपि चरकवाचनार्थं मिलिष्यामः पथ्यादिक्वाथपरं शानगन्धः prepare in clinic. Okay, and then you also prepare ghana from that. Or you use kvatha only. एनॅमलचा गुळगुळीतपणा कमी झाल्याने डिपॉझिट होण्यास अनुकूलता मिळते. ब्रश खरखरीत चूर्णाने दात घासणे तैलगंडूष डिपॉझिशन टाळू शकते. ओके, so dantahamche dantachale, this tailagandusha is there, that is given. So we may have to think, and there is as such no concept of medium brush or hard brush. Only soft brush has to be used. In no way a medium brush or harsh brush is of any help. So that is also the dentists say. So maybe we have tailagandusha on regular basis. And